Hey everybody, welcome back to my channel and welcome to episode 4 of my VCP and Me series. So today is part 1 of my VCP Explained series, where I'm going to have an interview with Dr. Virginia Kimonis. And we're going to talk about several questions that people have about VCP disease. First off, what is VCP? And then how does a gene mutate? What VCP disease is and its symptoms? How common VCP patients are misdiagnosed before they actually get to the VCP diagnosis. And how is VCP disease diagnosed? Dr. Kimonis is a professor with the Department of Pediatrics in the Division of Genetics and Genomic Medicine at the University of California, Irvine. She is very involved in the VCP community and is on the medical advisory board of Cure VCP Disease, Inc. So, Dr. Kimonis, I asked you earlier, what is VCP? And your response is VCP is the name of a gene that provides instructions for making an enzyme protein called Valosin containing protein, or VCP. This enzyme is found throughout the body and has a wide variety of functions within cells. What are some of those functions in cells?
So VCP has many functions, so very, very complex protein.
Maybe a top 5 or some of the key
the,
ones.
the top five is it's involved with degradation of proteins. So proteins have to be recycled. So proteins get broken down and then they replenish the supply, so the body makes new proteins. So it's very, very important in the proteasomal degradation of proteins, as well as the lysosomal degradation of proteins. So the
Okay.
lysosome is another organ in which the material from engulfed vacuoles digest in the acidic environment, whatever material like bacteria, viruses,
Mm-hmm.
whatever the cell engulfs into the lysosome. So, that's another very important function. It's important with in mitochondrial degradation as well. So again, that process is called mitophagy. And so there are just so many different aspects of degradation and recycling of proteins that's involved with. So
Mm-hmm.
you get accumulation of this proteinaceous material, and hence it's named multi-system proteinopathy. So you get this protein accumulated in the muscle, in the heart, the brain, um, you know, um, basically in the spinal cord, all of the organs, and leads to a dysfunctional cell and all the
Basically, an
clinical
ultimate
features.
deterioration of the muscle, right?
Yeah, so it's not just muscle. So you get involvement of the brain, the spinal cord,
Mm-hmm.
uh, and some people are very early, and half the folk have the bone disease called Paget bone disease, which is a very painful condition. It's something that is treatable, so it's not such a big issue. And some people have pain, they seem to cope with it. They attribute it to their muscle disease, more strain on their back. But Paget is treatable with bisphosphonates, and
Mm-hmm.
the pain melts away. So it's really important for people to be investigated for these aspects, at least for those that can be treated. So that's important.
Yeah, no, that's very good. So I think you covered a lot about what VCP actually is, in that statement. So I really appreciate that. How does a gene mutate?
So first of all, it's important to know the basic structure of a cell. So a
Mm-hmm.
cell is made up of a nucleus and the cytoplasm surrounding the nucleus. And within the nucleus are 46 chromosomes. We inherit 23 chromosomes from our mother, 23 from our father. At fertilization, you get 46. And those 46 chromosomes carry the 30,000 pairs of genes. So each pair comes from each parent. And
Mm-hmm.
VCP is one of those 30,000 genes located on chromosome 9 in the middle of the chromosome.
So what is VCP disease?
In VCP disease, one of those two copies is mutated. And that's called dominant, autosomal dominant, when mutation in one copy leads to a disease. The other copy is the function of that other copy is interrupted by this mutant copy. So it's a
Mm-hmm.
dominant effect. Um, so patients who carry the mutation, most often it's because they've inherited it from one parent, can be tested for the mutation.
Other terms for VCP disease include inclusion body myopathy, Pagets disease of the bone, and frontotemporal dementia, or IBMPFD. There's also multisystem proteinopathy, rimmed vacuolar myopathy, or Valosin containing protein, or vacuole causing protein. The first and most obvious symptom of VCP disease is inclusion body myopathy. Inclusion body myopathy is found in approximately 90% of VCP patients with an average onset age of 35 years. This is basically muscle weakness, which affects the limbs and can affect the vital organs such as heart and lungs. It also shows a scapular winging, which is muscle weakness around the shoulder blades, causing the shoulder blades to stick out and inhibit arm motion. The second symptom of VCP disease is Pagets disease of the bone, which is found in approximately 50% of VCP patients. This is caused by overactive cells that manage bone regeneration. It can show as bone pain, localized bone enlargement, and deformation of the bones. However, some patients with Pagets can have no external symptoms, and there are treatments for Pagets disease. The third symptom is frontotemporal dementia, which is found in approximately 30% of VCP patients with an average onset age of 55 years. VCP disease causes neurological degeneration, which may change personality, behavior, language, and speech. ALS, or amyotrophic lateral sclerosis, is also found in approximately 10% of VCP patients. ALS presents with many of the same symptoms as VCP, or inclusion body myopathy, Paget's disease, and frontotemporal dementia. So, Dr. Kimonis, everyone I have talked to, with few exceptions, were previously misdiagnosed with diseases such as MS or ALS. What other diseases have you seen VCP patients previously be misdiagnosed with?
One of our papers, we actually compiled a list of all the different disorders that patients were diagnosed with.
Mm-hmm.
So those diseases are not associated with VCP, but
Mm-hmm.
each of the individual components of VCP resembles those disorders. The most common is limb girdle muscular dystrophy,
Mm-hmm.
and the neuromuscular community have not always recognized VCP disease as a one of those limb-girdle muscular dystrophies. So that needs to be publicized more. Other disorders are sporadic IBM, which is a disorder for which we have no gene identified, but the pathology is not dissimilar, except there is no inflammatory cells that you see in VCP myopathy. So VCP is called a myopathy rather than myositis, because in the sporadic myositis, you have inflammatory cells. And then there are a whole host of other disorders that it is misdiagnosed as, like FSH, facioscapulohumeral muscular dystrophy, ALS. The vast majority of ALS does not have an identified gene yet.
How do you diagnose someone with VCP disease?
That's not it's a very simple process to test for gene mutation.
Yeah, I went through it. It was very straightforward, and my neurologist was good at explaining it to me and referring me to you, which was really helpful.
It's very important to have a high index of suspicion. Looking at the family history is actually very helpful, because if you find another family member who may have other aspects of the disease, for instance, a parent with dementia or a cousin with Paget or some other diagnosis of a neuromuscular disorder, or ALS is often seen in families, then, or even Parkinson's disease, then it should lead people to be aware. And I believe that every neuromuscular disorder for which there is no molecular basis identified, that person should be tested for a panel of neuromuscular disorders, which includes VCP. So recently, VCP has been included in many of these panels, but it wasn't the case. And so if people had their testing a few years ago, they should revisit the testing, which now includes VCP.
Yeah, that's really good, because I know, like, the familial studies, I think you call them, that's what you call them, are really important, because I know for the longest time while I was trying to be diagnosed, all I had to go on, because I was adopted, was a single piece of paper, which was a basic health screening. And just at the very bottom of it, it was mentioned that one of my grandparents had what they called Kugelberg-Weylander disorder,
Kugelberg-Weylander,
which I believe it affects the nerves. And so I kept getting, when I was getting the nerve conductive studies done, they were always focused just on the nerves. And it was only until my last doctor decided to go one step beyond and look at my muscles and not the nerves. That's when I got the real diagnosis, because everybody else said I was fine. I think they thought I was crazy.
right.
You
So
know,
Kugelberg-Weylander is spinal muscular atrophy, and you're right. And there are different forms of spinal muscular atrophy depending on the SMN2 number of copies that the person has. So yeah, some of my patients have been misdiagnosed as SMA, but of course the testing for SMA and FSH, if it's negative, then easily rules those disorders out.
yeah, but I mean, that was diagnosed probably 50 years ago, I think. And obviously genetic testing wasn't around then. So it's certainly plausible that he really had VCP, they didn't know.
Absolutely. I mean, even
Quick,
now, people don't always think about it, so I have patients diagnosed at an advanced age, even though there's a family history, making it very obvious that VCP is the gene that should be thought about. Yeah.
yeah, well, that's the whole point. That's what I'm trying to do. And you and curevcp.org and everybody is trying to raise awareness so people actually do think of it.
Right.
Because people ask for numbers on the Facebook group. People were asking, what is the number of people around the world that might have this disease? And we just don't know. And I suspect, and you might agree, that it's many multiples of what we actually think it
Oh,
is.
absolutely. So, I already have about 110 families, and each family has several members affected. So we already know that there are several hundred in the
Mm-hmm.
US, and then many more who are not diagnosed. But that's a good question for PerkinElmer. So PerkinElmer does free testing, and that is paid for by Sanofi, and some other companies have also jumped on the bandwagon in terms of offering free testing.
Hmm.
And this panel includes many genes, and VCP is included. So that has been an excellent way of identifying VCP. And of course, exome sequencing now is available. So many patients, if they have
Mm-hmm.
undiagnosed disorders, and their insurance pays for it, have exome, and then several patients have been identified with VCP mutations. So I was going to say, one of the things that I think is really important is for patients to be diagnosed early, and
Mm-hmm.
that can be done safely in pre-symptomatic patients, but it has to be done with awareness of the patient as to what they're getting themselves into.
Mm-hmm.
Genetic counseling is important, so the individual understands the implications of knowing the results before manifesting.
Mm-hmm.
The GINA law prevents discrimination, but that doesn't necessarily stop insurance companies discriminating if they got the results. We always tell people to get their life insurance in place. Just make sure that all the safeguards are in place before they learn of the results. But I feel that it's important to know the results early because it is life changing. You wouldn't do a job that requires physical strength when you know that that is something that will diminish over time. Maybe train in a job that requires more of a cognitive ability rather than
Mm-hmm.
a physical ability, or something that requires a lot of standing, stamina. I wouldn't encourage anyone to do manual labor, if you have VCP disease. So I
Mm-hmm.
think that's an important factor that endorses the benefit of early testing.
So that's it for part one of VCP Explained. In part two, Dr. Kimonis is going to discuss or who found the VCP mutation, what treatments are on the horizon, as well as VCP patients and exercise. Can we exercise? And then lastly, is it possible for VCP patients to rebuild muscle? So thank you for watching, and look forward to my next video.